sure that you all have what you need to complete this course successfully this evening. You were sent an email, a reminder email about 30 minutes ago, everyone that has registered. Please tap on that red banner at the top of the screen to access the handout and CE credit instructions if you don't have your hand on it. And that banner looks like a ticker tape right now. There are so many folks logged in here. It's exciting to see you all. So again, make sure you have the handout and the CE credit instructions, and we'll start exactly at the top of the hour. Okay. There's I think another 150 of you that just logged in. So you're gonna hear me repeat myself a couple of times here before we start. Please tap on that red banner at the top of the screen to access the handouts and the CE credit instructions. We have folks from all over this evening: Pittsburgh, Boston, Sacramento, Utah, Alberta, Virginia, Prince George, Virginia, New Jersey, Anthem, Arizona, and my backyard, which we have had a lot of rain, and it is freezing here in Arizona. I know you all are saying, yeah, right, it's freezing, but it's cold. Okay, everyone, again, I want to remind you all, if you've just logged in, to tap on the red banner at the top of the screen and access the handouts and CE credit instructions. Whitney said she's from Michigan. She was so excited to see this topic pop up because she works at a pediatric office and had a parent ask her about this topic. So good timing. All right, everyone, we are going to go live here, and let me bring up the presentation and introduce you all to our speakers this evening. I do want to provide you with a little bit of housekeeping. Excuse me. Again, we do have handouts, a course folder, and CE credit instructions. Check your email or tap on the red banner at the top of the screen. The course this evening is from 5 to 6 p.m., followed by a 30-minute informational webinar on Dr. Jen oral care products, NANO HYDROXYAPATITE. So you're going to have questions by the end of this course, so please stay on to learn more and learn how to access samples and so forth. This evening is NANO HYDROXYAPATITE Unmasked, Debunking Myths and Harnessing Science for Improved Oral Health. For those of you watching the recording later, please scroll below the video to the instructions section, and number 3 is the quiz. Any questions on how to get CE credit, you'll be redirected at the end of the presentation. You'll also be emailed the quiz at 7 p.m. Pacific time. And if you have any issues or you have any questions, you can type them into the chat area. With that, I'll go ahead and introduce Dr. Jennifer Eisenhuth first, who is a practicing orthodontist, but what she is most known for right now, she is a leading worldwide expert on the topic of NANO HYDROXYAPATITE. So you all are in for a huge treat. And she's accompanied by her husband, who is no less another expert in NANO HYDROXYAPATITE. So you have both here in stereo, but they also bring in different perspectives too. So after studying engineering at the University of Minnesota, Dr. Eisenhuth attended the University of Minnesota Dental School. She obtained her DDS in 1994 and her master's in orthodontics in 1996. And over the last 25 years, she has run a private practice and has been a part-time faculty at the University of Minnesota Dental School. In addition to private practice and teaching, she, along with her husband, Peter, have been committed to creating healthier and more effective preventive oral care products, oral hair. And I want to also tell you all that their entire family is in dental school right now. I don't even know how I would have managed that, but it's really a testament to what they want to provide, which is excellent oral care. And the research that they've done here is extremely valuable to all of you. Peter, over the last 25 years, has dedicated his career working in the dental care industry, helping doctors advance their level of oral care. Working alongside his wife, he has spent the last 5 years researching and developing clean ingredient preventive oral care products using modern and advanced materials. In addition to his constant pursuit to improve and develop modern preventive oral care products, he works closely with dentists and hygienists throughout the country, providing instruction and education on the use of modern preventive oral care products. So you all are in the right place this evening if you are looking for all the information and the correct information about nano hydroxyapatite. So Dr. Jen, I'm turning it over to you. We'll be here in the background.
Thank you so much, Dr. Rawlings. Great to see everybody again tonight. We really appreciate your time. I'm just going to pop through some of these initial slides here. That's me. That's my husband, Peter. And you know what Dr. Rowling had said in my bio in the introduction is that my undergraduate degree was in civil engineering. And the reason I chose engineering is that I like to find problems, and then I like to find solutions to those problems. And going through the engineering program, I realized, you know, I actually love people, I love health. And so I ended up in dental school because, as we know, the human body can be full of problems that need solutions. And so eventually I finished dental school and then, of course, my orthodontic program. What you see in front of you right now was actually my very first ad as a new graduating orthodontist. This was, you know, I mean, I had no budget, of course, you can kind of tell, pretty simply done. But this is our first ad, and it's a photo of my husband, Peter, me looking much younger. And then the whole reason that we ended up in toothpaste is because of that young lady, that young girl that I'm carrying there. Her name is Claudia. She is our oldest daughter, and I had her during my residency. But she is why we are here in front of you today. Eventually, Claudia grew up. She went to college, and she had applied to dental schools. And during finals week, pretty intense, you know, testing, she called me one night and she said, "Mom, my jaw is killing me. I can't sleep, I can't study, it's interfering." And she was going to school in northern Minnesota, pretty small town. And so I contacted a classmate of mine who was a dentist in that area and asked her if she'd be willing to see Claudia, you know, after hours, which she did. And she thought, oh, I think she, you know, fractured a tooth. I'm going to send her to an endodontist, gave her some antibiotics, sent her on her way so she could at least get through the testing. The endodontist in this small town, you know, wasn't there very often. So Claudia had to wait a few weeks to see him. And what ended up being about 6 weeks of antibiotics to help her with this fractured tooth that she had eventually wiped out her biome, and she ended up getting what's called C. diff. And her C. diff was unfortunately strong enough and severe enough that she ended up admitted into the Mayo Clinic in Rochester, Minnesota, one of the youngest patients that they've had there. And in her time there, it was pretty serious. You know, when we went to see her and visit her, we had to put on those paper yellow gowns and make sure we weren't bringing any germs into her area. But while she was there, the physicians told us and told her that essentially she had to treat herself as though she were a newborn. Her biome was wiped out. So she had to watch what she ate. She had to watch the products that she used, just like you would with an infant. And you know, we thought, okay, you know, we can do this. You know, what she ate is kind of up to her, but, you know, we changed the laundry detergent and the soap and the shampoos that we had in our house. And honestly, being in the dental field, I thought this is going to be simple. I will find a clean ingredient remineralizing toothpaste without any problem at all. But I was wrong. It was a problem. I could not find a clean ingredient toothpaste. And I mean clean ingredient toothpaste that would remineralize teeth. And I and Peter bought every toothpaste, you know, in stores, on the shelves, online, everything. We really lost our bathroom and our kitchen table to all these different types of toothpaste. And I was seriously disappointed to not find one that fulfilled what we were looking for. And, when you look into what's in toothpaste, there's a lot of endocrine disruptors within them. And she couldn't have that. Her gut couldn't take that. She couldn't have synthetic coloring and flavoring. We know that messes up with our endocrine system. PEG, which is just a fancy word, for petroleum, really, and that's what's in antifreeze. And then, of course, sodium lauryl sulfate. That's just not good for us. It creates some nice foaming, but it's not great for our biome. And so the question really comes up, if with all the advances that we've had since all of us were in our dental programs, if you think about, we used to take x-rays that, needed to be developed, or we would take impressions and now we can take scans. All these changes that have happened in dentistry, why are the toothpaste formulations pretty darn similar to what they had in the 1960s? And in Europe, they're really careful, more careful, I think, than the United States about what goes in, what's allowed to go into ingredients or into formulations. And they ban some of the things that are in our toothpaste today. And so that's really what has led the two of us and our family into, diving into, into toothpaste and ingredients within toothpaste. There are, and Peter will take you, soon from here. He's great with the education. I'm still seeing patients in my day job. But there are basically two different ways to remineralize enamel. You can do fluoride, which we all know about, or you can do nano hydroxyapatite. And it has to be at the right concentration, the right particle size, but it will work as equally well as fluoride at strengthening enamel. Now, the problem is ultimately that if you take fluoride out of a toothpaste, the FDA turns their head. They're not looking at it anymore. And so that means that brands can put whatever they want. If they take fluoride out, they can put anything in there and they can claim anything. And nobody's watching them and nobody is keeping an eye on it. And so that's what really got us here, because as a dental professional, I didn't feel like that was right. I didn't feel like it should be, let the buyer beware with healthcare products. And I think we all think, that protecting enamel is so important. Let's make sure that when we are protecting enamel and recommending products for our patients, that we're doing it the right way. I'm going to let my husband, Peter, take it from here. He is Mr. Education, and so he'll give you all kinds of good stuff. Looking forward to hearing any questions at the end of this too. Thanks, guys.
Hey, thanks, Dr. Jen. Everything I'm going to share with you, I've learned from Dr. Jen. And yes, I get to do this all day. I get to meet with dental offices. We're lecturing all over the country now, even dental schools. And so we're really excited. I'm glad Jennifer shared our journey on how to get here. But there's been a lot that we've learned over the last 5 years. We've spent a lot of our personal savings learning about nano hydroxyapatite. So within this hour presentation, by the end of it, you guys are going to be the experts. You're going to be the authorities to be able to help your patients understand what's required for nano hydroxyapatite to replace fluoride. So let's see. I got to go back to the slides here. There we go. Boom. Okay. So Jennifer had mentioned that, for our patients, most of our patients, to avoid caries, they need some type of proven remineralizing component in their toothpaste. Why is that? Well, it's mainly due to bad bacteria in the mouth, bacteria like Streptococcus mutat. I know this is review Dentistry 101, but I just want to hit on the basics so we can really talk about how nano hydroxyapatite can counter the effects of caries. So if we look at majority of the population, not all of us, we've contracted certain bacteria that becomes very active when we're eating this nice Western diet, consuming sugars and starches. Well, when we consume sugars and starches, acid-causing bacteria becomes very productive, and it creates an acid, and it causes demineralizing. Well, unfortunately, throughout the course of our lives, or even over shorter periods of time, most of our patients have phosphate and calcium deficits. And we know over time that if they have phosphate and calcium deficits, that caries will form. So I'm going to talk about pH cycling a little bit and really, what's occurring in the mouth that can contribute to caries. So as we said, when an acid is created, what happens within the enamel, phosphate and calcium starts to leave the enamel. So the critical pH of our enamel is about 5.5. So as the pH levels come down to about 5.5, phosphate and calcium starts to leave the enamel. Well, typically 30 to 40 minutes after eating, our saliva has a wonderful thing called bicarbonate. Yes, it's like baking soda, but basically our saliva has the ability to bring our pH back up. When that happens, when we're back up to neutral around 7, there's phosphate and calcium ions in our saliva that's going to help remineralize our enamel. So theoretically, our bodies can heal itself, and that's true within our mouth. Throughout the day, pH cycling occurs. However, mainly due to high counts of bacteria and our Western diets, saliva in itself isn't enough, and our patients have phosphate and calcium deficits. So to counter these phosphate and calcium deficits, two clinically proven ingredients that one that we're aware of, the second one you will be aware of. Number one is fluoride. Let's talk about fluoride a little bit. It's just a little bit of recap. What is fluoride going to do for our patients? Now, if your patients are brushing with fluoride or they're getting a fluoride varnish, what's going to happen is that fluoride, it's going to interact with surfaces of the enamel, creating fluoroapatite. If we look at the enamel itself, the composition, the chemical composition, it's calcium, phosphate, and oxygen and hydrogen. So what happens is when fluoride is introduced, the hydroxy group in hydroxyapatite is replaced with a fluoride ion. We know fluoride ions are dense and they're negatively charged. It's going to help pull the ions tighter together in surfaces of the enamel where the fluoride's impacted the enamel, making the enamel more resilient to acids. Typically, it drops the critical pH of our enamel from about a 5.5 to a 4.5. This is a good thing. This means when our patients have these acid attacks with this low pH cycling, they're going to have less demineralizing. This is good. The second thing that fluoroapatite is going to do, if I go back to the previous slide, it's actually going to help pull in more phosphate and calcium ions from our saliva. And that's a big plus. That being said, it's really important to note that fluoride by itself does not contain phosphate and calcium. It's also important to know that without healthy saliva flow, fluoride is really not the most effective way to help offset phosphate and calcium deficit. That being said, for patients with healthy saliva flow, we know fluoride works. There's no disputing it. It will help prevent caries.
I'm just going to say through all of dental school, everything that I felt like I learned, this piece of it, I don't think I caught the first time around. Maybe I didn't catch it the first several years around, but fluoride really does need calcium and phosphate to create that fluoroapatite ion. And without the calcium and phosphate, it really is kind of useless.
Just a fun fact, we study all kinds of fun facts. We have fun here at Dr. Jen's. The average healthy human being produces 100,000 gallons of saliva. That's quite a bit of saliva. And yes, saliva is the fountain of youth. Unfortunately, we're not all of us have that ability to produce healthy saliva. Just another note on saliva. It does have antimicrobial benefits. There's a number of things that saliva will do, and you guys already know most of this. It's going to help remineralize. It's going to help lubricate. It helps with antifungal, wound healing, et cetera, et cetera. Let's see. We'll go on to the next slide here. This is really a slide we want to address. Just want to bring up. Jennifer talked about how fluoride really is dependent on healthy phosphate and calcium ions to remineralize. On the center of this slide, this is just a paragraph within a PubMed study. Most of the studies we reference, by the way, are going to be on the National Library of Medicine. They're PubMed. If we make claims, we will back them with clinical studies. But I want to address this study. This study was an overview on calcium and phosphates in basically oral care. And to just read from the slide itself, fluorides require calcium and phosphate ions from saliva to improve the natural remineralizing process. Further down, I'll read the last sentence. For xerostomia patients, oral care products with the addition of calcium and phosphate are recommended. And why do we bring this up? Well, we're working with thousands of offices all over the country now. And what most offices are sharing with us when they're seeing high caries patients In many cases, it's not their oral care hygiene routines. In most cases, there's generally there's another culprit here, and it's generally a lack of saliva. So you guys probably know the stats, but the estimates are anywhere from 25 to 30% of Americans have some type of xerostomia. For example, aging population, if you're 75 and older, 50% have some type of xerostomia. This is a really sad number. There's over 400 prescription medications that are being prescribed in the US that cause xerostomia. And some of these are with young patients. Adderall causes xerostomia. Mouth breathing, obesity, we can go on and on. The reason I'm bringing this up is if we understand how fluoride works, it's really important to know that fluoride is dependent on healthy saliva to bring phosphate and calcium ions in. Now, as we talk about nanohydroxyapatite, you're going to see that nanohydroxyapatite will trump fluoride in situations where we have xerostomia. This is just some more statistics on xerostomia. I don't think we just did a pediatric event, and I had no idea. Did you know these numbers were as high as they are?
I didn't know these numbers, prior to reading some of these reports. I think it's interesting how many kids mouth breathe, and when they do, they are going to be more susceptible to decay just because they don't have the protective value of enough saliva, in their system.
Yeah, and yes, saliva is, if you don't have healthy saliva, it's going to increase Streptococcus mutans counts. And the reason I brought that other slide up is I just got a call 2 days ago from a dentist whose 2.5-year-old she said her daughter is getting cavities and has bad breath. And the first question I asked, I said, well, is your child a mouth breather? And she said, yeah, she's breathing through her mouth. And you guys get it. Without healthy saliva flow, fluoride is not going to be the best resource for them. Go through this a little bit faster. Okay, so nanohydroxyapatite, what is it? Okay, for a lot of you listening tonight, you probably never heard or never looked at nanohydroxyapatite really closely. If we want to break it down, it's a crystal. It almost looks like powdered sugar, very close up, but it has calcium, phosphate, oxygen, and hydrogen. For your patients that do not want fluoride, they absolutely do not want fluoride. If you're going to recommend nanohydroxyapatite, the first question they will ask you is it safe to swallow? Yes, it is. You'll find that there's many applications for it. But when we swallow nanohydroxyapatite in our toothpaste, what happens is these crystals dissolve. We said the critical pH on our enamel is 5.5. Well, nanohydroxyapatite are basically crystals of our hydroxyapatite. The typical stomach lining runs between 1.5 and 3.5. So when we swallow nanohydroxyapatite toothpaste, the crystals dissolve. It's so effective as a source of calcium and phosphate. There's actually some powdered baby food manufacturers that include nanohydroxyapatite in. Now, there's going to be another question that will come up if you're recommending a nanohydroxyapatite as an alternative to fluoride for your patients that do not want fluoride. And that will be, does nanocrystals cause cell toxicity? Within the US, the Food and Drug Administration, at least today, doesn't provide any oversight or regulation on this. However, as Jennifer mentioned, the European Commission does. Europe is super tight on all of their regulations. For example, you cannot buy a product with hydrogen peroxide in it. We have most of our over-the-counter bleaching products have hydrogen peroxide. You cannot buy that in Europe. Titanium dioxide is another ingredient. It's in sunscreen. Well, titanium dioxide, when it's put in sunscreen or even in certain toothpaste to elevate the whitening, it comes in a nanocrystal. Well, think about that a little bit. There's certain nanoparticles that can pose a threat to cell toxicity. However, nanohydroxyapatite in itself, the European Commission deemed that it was safe in toothpaste. The European Commission published an 8-year-long study that was published last March. This is the actual study itself, but I'm just going to paraphrase in their opinion. They said that nanohydroxyapatite is safe for humans based on the data provided. The SCCS considers hydroxyapatite and nanocrystals safe when it's used at concentrations up to 10%, number one, and that the crystal is a rod-shaped crystal. And so if you are researching brands to recommend for your patients, I think that's a really important question to ask the manufacturer that you're considering to recommend. You know, what is the shape of the actual crystal? Nano hydroxyapatite crystal, when it's manufactured, whether if it's manufactured or if it's used through natural resources, the end product can come in different sizes, different shapes. Well, rod shape right now is the one that the European Commission does sign off on. On a side note, I'll just throw some fun facts out here. Sphere is another synthesized nanohydroxyapatite. Amorphous would be something like an eggshell. There are natural forms of nanohydroxyapatite. They could be bovine, eggshell, seashell, and then there's needle. Now, if you read the European Safety Commission report on the safety of nanohydroxyapatite, it's actually the crystal. I'm sorry, not the crystal. It's called a needle shape. That's the one they consider suspect. Well, they don't say in this safety report that needle shapes of nanohydroxyapatite cause cell toxicity. They just say it's suspect. Well, our body produces nanohydroxyapatite crystals within our bone structure. And yes, what our bodies produce are actually needle-shaped crystals. It's just more information than you probably wanted to know. But the biggest takeaway here is if you have patients that have concerns about cell toxicity, I think referencing the Scientific Committee on Safety, on Consumer Safety by the European Commission is a good resource to forward to them. And the big takeaway there is rod-shaped crystals. Fun fact, eggshell. Eggshell's been used for quite a long time as a remineralizing ingredient. When we started researching nanohydroxyapatite, as we said, there are natural forms of it. Eggshell is one. And yes, there's historians that show eggshells to be used in toothpaste that date back as far as 3000 BC. That's interesting. I guess the Egyptians knew quite a bit about toothpaste back then. So who invented hydroxyapatite anyway? And the reason I want to bring this up is not only who, but the when. There's manufacturers out there that don't use hydroxyapatite or nanohydroxyapatite in their toothpaste. And when they're asked this question, one of their quick responses is, it's like, well, there's not enough science behind it. We don't know enough about it. Well, that's the furthest thing from the truth. So we're talking about debunking myths. If you don't know this, hydroxyapatite was created 50 years ago. There's a half of a century of science behind hydroxyapatite. Well, who created it? It was NASA. Why did NASA create a toothpaste? Well, there's for a number of reasons. Number one, the initial capsules that went up to outer space were very confined. The astronauts didn't have a toilet. Yeah, they had to wear diapers. They didn't have a sink to spit their toothpaste into. They had to swallow it. So it was that combined with the effects of anti-gravity. The astronauts were returning to Earth having major bone loss and enamel loss. And so NASA set out to create an edible toothpaste that could replace fluoride. And it was proving to be so effective that there was a pharmaceutical company in the early 70s that bought the patent from NASA. The company's called Sanji. Anybody studying nanohydroxyapatite, the science behind it, we really have to give this company a lot of credit. They've spent decades, tens of millions of dollars advancing hydroxyapatite into higher versions of, or higher, more advanced particle sizes of nanohydroxyapatite crystals. But just fun fact, the first nanohydroxyapatite toothpaste was released in 1980. We're talking, there's nanohydroxyapatite or hydroxyapatite toothpaste, its first version, first form, it's been around for over 40 years. In 2003, this company was able to advance a hydroxyapatite crystal or micro into a nanocrystal. We're going to talk about this more, but there are tens of millions of people that have been using nanohydroxyapatite in Asia, mainly in Japan, and then also Europe. There are thousands of clinical studies, and we're going to touch on a few of them on nanohydroxyapatite with its widespread application. So this is a material, even though it's new to you, and it's new to most dental universities in the US, there is a lot of hard science. There is 50 years of history on hydroxyapatite and nanohydroxyapatite. Interesting fact, even though currently the Food and Drug Administration in the US doesn't recognize nanohydroxyapatite as an anti-caries ingredient like fluoride, The Japanese government approved hydroxyapatite in 1993. I think I have it up here. Yeah, 1993 as an anti-caries ingredient. So for the last, I got to do quick math. For the last 30 years, nanohydroxyapatite has been recognized as a medicine in Japan. What makes this even more interesting is we, or the US, we're the ones who created hydroxyapatite. But it just says that we're lagging. When I say the US is lagging a little bit in using advanced remineralizing ingredients. And we're just happy, though, that there's other countries that have really pioneered and advanced the materials. So countries like the US can use this science to advance our patients' oral care. This is our son, Gabriel. We do have a team here. Our son, Gabe, has his master's in biomedical science. He defended his thesis on nanohydroxyapatite at a dental school. He's currently publishing a paper on nanohydroxyapatite at a dental school. He's a current dental student. You won't find a family more dedicated to developing and advancing nanohydroxyapatite and helping other dental professionals understand the science behind nanohydroxyapatite. Now, I want to get into some clinical studies. I won't go too deep because we don't have a lot of time, but I do want to emphasize that if a brand or a manufacturer is going to make a claim about nanohydroxyapatite, it's really important that they can back it up with hard science. If you go to the National Library of Medicine, and if you type in nanohydroxyapatite, you'll see that there's over 3,000 studies on nanohydroxyapatite. What's interesting is if you follow the timelines, there's a huge spike. There's clinical studies being published weekly on nanohydroxyapatite. So as I said earlier, there's a lot of history, there's a lot of hard science, and it's becoming a more popular ingredient, not just in dental, but also in medical applications. I'll just touch on a few of medical applications of both hydroxyapatite and nanohydroxyapatite. Orthopedic surgeons have found that if they coat synthetic joints with hydroxyapatite, they have better biocompatibility. Why? Well, 60% of our bone structure is hydroxyapatite. It's used in bone grafting material, cartilage repair. It's also used in dental implants. You guys have probably seen this in some of your practices. Better biocompatibility if you can coat the dental implant with hydroxyapatite. It's used in bone grafting procedures, cancer detection. It's actually used in cancer treatment. So the applications of hydroxyapatite and nanohydroxyapatite is growing. It's not going away. And we're excited that we can share with you today how it works in toothpaste. So let's hit this hard. Let's talk about, we know the history of nanohydroxyapatite. We know it has many applications, but how does it work in toothpaste? Let's break it down. Really, there's 4 things nanohydroxyapatite is going to do in toothpaste. So number one, the crystals, if they're the right size, a nano crystal, less than 100 nanometers. You can actually see this on the image on the bottom left-hand side. These crystals it's a hexagonal rod-shaped crystal. They'll adhere to the proteins within bacteria like Streptococcus mutant. And this is wonderful. And we know, as we had mentioned earlier, one of the biggest reasons our patients have caries is because of bad colonies of bad bacteria. So if your patients are brushing with high concentrations, 10% of nanocrystals, you will notice less biofilm, less plaque. That means less acid-causing bacteria. Works wonderful at it. Number 2, the crystals will fill in scratches, microlesions, surface pores on the surface of the enamel. We all know that when we give our patients prophy paste, we polish it up. We do it for a number of reasons, but one of the main reasons is if the surface of the tooth is really smooth, it's going to help prohibit plaque from adhering. Well, instead of removing enamel to smooth off the surfaces of our patient's enamel, here's an opportunity where we can actually fill these surface lesions in a little bit and make the surface of the tooth smoother. And so the second thing nanohydroxyapatite will do, it's going to make the surface smoother. That's going to help reduce the plaque's ability to adhere to the surface of the enamel. Plus, you're going to get some surface remineralizing. Number 3, and this is what's really exciting to know. We know that with acid, when our patients go through the low pH cycling, acid will get below the surface. And why is that? Well, we have surface pores, if you want to call them that. But basically, if you look at the structure of the enamel, it's a hexagonal crystal structure. and there's actually gaps between the actual crystal structures, and acid will get in below the surface, creating incipient caries. And you guys know what incipient caries is. Incipient caries are one step prior to actual decay. Well, if the crystals are small enough, a nanocrystal, they'll be able to penetrate into the surface pores to remineralize incipient caries. There's some images on the bottom left-hand side of this slide that show remineralizing of incipient caries. These are photos taken from a study done at the University of Texas Health Science Center. But if you look at the image on the left, you can see a gray matter right below the surface of the enamel. That's before brushing with nano hydroxyapatite crystals. And then the image to the right is after. You can actually see a reduction in the incipient caries, or that gray matter. So nano hydroxyapatite, wonderful. It will remineralize below the surface of the enamel. And then lastly, nano hydroxyapatite is excellent for managing hypersensitivity. There's a number of ways to manage hypersensitivity. The most popular is using a pain block. And we talk to a lot of dental offices, and I don't think they talk about this in dental school at all, but the most popular ingredient to manage patients' hypersensitivity is potassium nitrate. Potassium nitrate, it is, number one, it's a pain blocker. It does little to nothing to protect weak areas of enamel or exposed dentin. So how potassium nitrate works is when you're brushing with potassium nitrate, or your patients are, it's going to block the pain signal from the nerve of the tooth to the brain, addressing the symptoms. Nano hydroxyapatite does the opposite. It will actually fill in the dentin tubules. If it's the right crystal size, we need nano, this over and over again, but it will also provide a protective patch or coating. And you can see this on the images on the left bottom, the lower left of this slide. This is a study that was published October of 2016. There's at least a dozen studies like this on PubMed showing the efficacy of nano hydroxyapatite to manage hypersensitivity. But more importantly, nano hydroxyapatite doesn't address the symptoms. It's going after the problem. It's coating weak areas of enamel and exposed dentin. Next, let's talk about how do you know, I think this is probably the best question of the evening. How do you know that nano hydroxyapatite is going to provide the same remineralizing levels as fluoride? And that's what we all want to know. If you're going to recommend a product, a replacement for fluoride, we have to understand the science, and you have to have confidence in that. Well, how are ways that we can test fluoride against nano hydroxyapatite? Well, there's a number of studies on PubMed. I'm going to reference a couple of them. The first study I'm going to reference, I love some of the imagery in the photo, so I'll hit the highlights of it. But if you guys want to go deeper into the science, this is a PubMed study. You can see it there. It's numbered. Let's see, when was this published? September of 2019. But with this particular study, they tested 3 different toothpaste ingredients side by side to determine what the efficacy was with the remineralizing. Well, how do you do that? How do you test one product against another product? Well, generally what these scientists will do and dentists will do at the dental school or the labs, what they're going to do is they're going to take healthy teeth. Number one, we got to take healthy teeth. They're going to get a batch of healthy teeth, and then they're going to create a lesion on that particular tooth by applying acid over a series of events. And then they'll establish a baseline on how deep that lesion actually went. And then they'll break the teeth up into different groups and simulate pH cycling over a series of events. And so I'm just going to highlight how they conducted this study. So if you look at the images in the bottom left-hand corner, that you'll see 6 pictures of a tooth. That's the same tooth taken over 6 different time intervals after acid being applied. So if you can read the labeling on it, it's labeled A through F. Well, A, the enamel surface is beautiful. It's perfection, right? No traces of caries from what we can see with the naked eye. But if you look at each sequential photo, acid is being applied. If we look at image F, the surface of the enamel is destroyed. There was an artificial lesion created. So once again, we're going to take a bunch of extracted teeth, create lesions. Now we have to measure how deep the lesion went. Well, there's different ways to take measurements. You can do Victor's hardness test, or you can use something that's like a polarized light microscope. And that's what we're looking at on the bottom right-hand corner. We've got images A through C. Those are different teeth. They're labeled A, B, C. What we're looking at on the very top row, though, that gray matter, that's the actual lesion itself. Now, if we look at the bottom photo underneath each A, B, and C, that's the respective tooth after 7 days of pH cycling using a given toothpaste. We can see with these 3 different images, A, B, and C, that there is a reduction in the actual lesion. Well, it's really hard for us with the naked eye to determine which toothpaste performed better. And yes, A, B, and C were 3 different toothpaste, and those were just 3 of the samples they used. But they summarized with the study after taking extracted teeth, dividing them up into 3 different groups, brushing with 3 different toothpaste over pH cycling over a 7-day period. They measured the amount of a reduction in that lesion. And so they determined how much remineralizing occurred. Well, the graphs on the right are basically the summary of this particular study. And what we learned from this study is that the toothpaste, and this was the first graph, containing 10% nano-hydroxyapatite, provided the highest level of remineralizing. The second toothpaste, you're probably familiar with the ingredient. It's calcium sodium phosphosilicate at 5%. And then, yes, the third bar represents fluoride at 1,450 parts per million. So this is just one of many studies showing nano-hydroxyapatite. Actually, in this study, nano-hydroxyapatite outperformed fluoride. And that's the 1,450 parts per million study. That's a higher over-the-counter level of fluoride. So there's at least a dozen other studies like this on PubMed. I'm just going to put up one more. You guys could go. We don't have time to go through a lot of the studies, but I just want to support the claim that nano-hydroxyapatite can be just as effective as fluoride. Here's another study. This one, they did a hybrid study where they were able to do an in vitro study. They set this study up the same way. They took healthy extracted teeth, created a lesion, but they cut blocks, enamel blocks out of the lesion area, attached them to an orthodontic appliance. They found subjects willing to wear these attachments around for 4 weeks. One group brushed with fluoride, one group brushed with nano-hydroxyapatite. And what they found after removing the attachments and measuring the remineralizing surface of the remineralized area, that fluoride performed just as well as nano-hydroxyapatite. So big takeaways here is that, yeah, nano-hydroxyapatite can be just as effective as fluoride. However, when we look closely into these studies, we have to understand for this to occur, there has to be enough nano-hydroxyapatite in the concentration. As Jennifer mentioned, it's the Wild West, and most brands are not following the science. They're going to put in diluted concentrations, yet they're claiming that their products are just as effective as fluoride. You know, until we see clinical studies supporting low concentrations of nano-hydroxyapatite delivering the same remineralizing levels as fluoride, that's misinformation.
Can I interrupt you just for a second here? I do want to, I'm just going to pull in a little bit of our toothpaste adventure here. After reading all of these studies and looking into what we found on PubMed, when we finally had this formulation of toothpaste and went to all the manufacturers and said, hey, we want to make this toothpaste, we're so excited. Every single one of them said, you don't want to put in 10%. And the reason why was money. 10% is expensive. And so they're like, oh, you know what? You only need to sprinkle it in 1, 2, maybe 3%. That's good enough. And our response was, it's not good enough because the science shows it's not good enough. It's not strong enough to remineralize at the same level as fluoride. And their answer to us was, you know what? Dentists aren't reading those studies. And so that's part of why we are here today, because you know what? We do read those studies and we know what needs to be in that toothpaste to be just as effective. Sorry, Peter.
No, that's a good point. It is, and this is, once again, there are dental professionals that are claiming 1 to 3% concentrations are optimal for nano-hydroxyapatite. We read every clinical study. We've never seen one stating that. Instead, the opposite is true, and that's 10% is the optimal concentration. I just referenced this study. This is a study here. The previous study, this is the cover page for the study, but I'm summarizing it. They tested 1, 5, 10, and 15%. You do get a plateau effect once you get to 10%. However, if you cut concentrations below 10%, remineralizing levels drop significantly. And you can see that on the bar charts here. The gray bar is at 1%, the teal bar is at 5%, the black is at 10%. So it's not it's not Jennifer telling you that 10% is optimal. It's what the science is supporting. To take this a step further, you guys know what a scoping review study is. This is not our study. Scoping and review study, if you're not familiar with it, this is when dentists and scientists sit down and they read all of the white papers on a particular claim, and they're going to come up with summary points. Well, this is a scoping review study that was published May of 2022, and it was very clear in there, and we've got a quote on the very bottom that, yeah, nanohydroxyapatite does all of these wonderful things. It can decrease demineralizing. It has caries inhibition. It whitens teeth. It manages hypersensitivity. But if we read this sentence, it's just part of the study, and we want this up there so you can read it yourself, go into the hard science, but it says the optimal concentration is 10%. There's no disputing this with the current studies done on PubMed. Now, if manufacturers are saying, well, we did our own studies and we show that 1% or 3% is just as effective, ask them for third-party non-funded clinical studies to support their claims. What we're sharing with you right now are published studies on the National Library of Medicine. So that is really one requirement based on current science for your patients to get the same caries or optimal protection is you'll want them to have high enough concentration of 10%. Now, how you come up with the concentration can be a little bit convoluted. You want to know what the final concentration. There's brands out there that are going to say, well, we use 15% liquid with 20% concentration, and they're throwing numbers around a little bit. So when you're interviewing your brands to recommend a product with efficacy to your patients, ask them one question: what is the final concentration? If they start throwing around, well, we have this liquid we use at 20%, this or that, just ask them, what is the final concentration? If it's not 10%, they're not following the science by providing optimal levels. Let's see. Let's talk about size. Yes, size does matter. And this is the other thing. As we said earlier, there's nanocrystals were developed in 2003. Prior to that, NASA developed hydroxyapatite, which are more microhydroxyapatite in the early 70s. So we know materials are advancing all the time. What we do understand about hydroxyapatite, if we follow these studies that we referenced, nanohydroxyapatite to deliver the same efficacy as fluoride, the crystals have to be a nanocrystal. They got to be small enough, as we said earlier, to penetrate the surface pores to remineralize incipient caries. The image I have on the left is animation of exposed dentin. Same thing here. For these crystals to penetrate dentin tubules, they have to be smaller than 100 nanometers. So what's the big deal? What's the difference between nano and micro? There's a huge difference. Micro is an outdated crystal for toothpaste. Okay, it was created in the 70s. Nanocrystals are advanced materials. They were created in 2003. If we look at the images on the left, you can see nanocrystals have the ability to penetrate surface pores, but we also get more of a consistent blanketing effect. Microhydroxyapatite crystals are outdated, number one. Number two, they're 1/5 the cost. So why would a brand put in a micro over a nano? And we were advised of this when we were doing our research. They say, well, just put micro in. You'll get some surface remineralizing. And so, yeah, don't get me wrong. You will get some benefit. There is some benefit using micro. However, you're not going to be able to have those crystals penetrate surface pores or penetrate the dentin tubules. And you can see that on the right. Well, there's some brands that think they're really clever and they'll combine the two. Why would you combine the two? Because if you can look at the images on the right, those microcrystals were actually going to plug some of the surface pores if they adhere. So two biggest takeaways tonight for you to understand nanohydroxyapatite, and that would be based on current science, we want the crystals to be a nanocrystal, and there's a PubMed study referenced in the very top of the screen addressing this. It says microhydroxyapatite particles are 5 to 10 microns in size, and this is significantly larger than the surface pores or the dentin tubules. So great takeaways for you. We can talk about nanohydroxyapatite all night. There is another study, and I think this is this is a great study. It talked about remineralizing root caries. Yes, if it's a nanocrystal, when it penetrates the surface pores. There is one study, and this is the study showing, and I could read it, says for dentine, even higher remineralizing effects could be achieved with nanohydroxyapatite toothpaste. So there are studies showing to help reduce root caries. If the crystals are nanocrystals, your patients will get some benefit for remineralizing below the surfaces of the enamel.
Okay, so we started this discussion talking about our daughter Claudia. She did need to defer dental school for a few years just to get back on track with her health. But she is currently a D3, almost a D4 at Minnesota, and she just did a presentation on hydroxyapatite or nano hydroxyapatite toothpaste at Minnesota.
Awesome, cool. We want to get you some time for some questions, so I'm going to kind of go through this here. What's interesting is if you combine nano hydroxyapatite with fluoride. Well, the traditional approach to manage high caries, we have 2 kids that go to 2 different dental schools, and what's being taught in dental schools is just up the fluoride, up the fluoride. Well, you guys already know that if there's suspect for xerostomia, there is a better solution, and that's nano hydroxyapatite. So instead of recommending high prescription fluoride toothpaste, why not pick a toothpaste that combines fluoride with nano hydroxyapatite? There are clinical studies supporting this. And so this is a clinical study published winter of 2017, where they combined high concentrations or higher concentrations of nano hydroxyapatite with fluoride and found that there is a synergistic benefit. And I think we went over the how fluoride works, how nano hydroxyapatite works. If you combine the two, you get higher levels of remineralizing. And so this is a healthier, or it's a way to expose your patients to less fluoride, but get higher levels of remineralizing. Just the highlights on this particular study, the teal bar represents 7% nano hydroxyapatite with over-the-counter levels of fluoride against fluoride alone. And yes, you do get synergy when you combine the two, and that's a good thing. This is a study, a pilot study. We'll talk about this more in a little bit, but with this study, it combined 10% nano hydroxyapatite. It was a pilot study, so it's a new study that was done in December. 10% nano hydroxyapatite, high concentrations of xylitol with over-the-counter levels of fluoride, testing it against high prescription fluoride in a xerostomia environment. And the outcome was amazing. We got 6 times higher levels of remineralizing by combining nano hydroxyapatite with fluoride. Let's see. What about varnish? We want to talk about varnish a little bit. There's only one study right now out on varnish. And this is what's interesting. It shows that a gel with 20% to 30% concentration of nano hydroxyapatite outperform a varnish. There are no studies that we're aware of on the National Library of Medicine supporting a nano hydroxyapatite varnish to be effective as fluoride. And we got to think about the biophysics of this, how a varnish works. A varnish has a shellac in it, a sealant, all right? For nano hydroxyapatite to be effective, at least today, from what we know, it has to be able to penetrate the surface pores, get into the dentin tubules. If you're going to put a shellac on a tooth surface and your patient is brushing with nano hydroxyapatite, the varnish itself, the material of the varnish, can inhibit the ability for the crystals to penetrate the surface pores, number one. Number two, if you look at varnishes, the concentration that you'll see in a varnish is usually 5%. That's 20 times higher concentrations than what's in the toothpaste. So from what we know and what we've understand about varnish as we study this is you're giving your patients kind of a super dose of fluoride or a super higher concentration, about 20 times higher. So we know that the optimal concentration in a toothpaste for nano hydroxyapatite to be effective is 10%. Anything less than that, if you have a brand out there claiming that, well, gosh, yeah, this is just as effective as fluoride, just ask for some hard studies on this, because, whatever you're recommending, you want to make sure there's hard science behind it. Whitening, yes, nano hydroxyapatite can also help whitening. With the studies out there, 10% is optimal. Let's see. Debunking myths. I think you guys get this. Concentration does matter. Based on current science on PubMed, particle size does matter. There's some other misinformation. There's one that says glycerin prevents nano hydroxyapatite from providing mineral uptake. That is not true. The first study that we showed you regarding 10% nano hydroxyapatite outperforming fluoride, that was a glycerin-based toothpaste. Let's see. Nano crystals of hydroxyapatite are not safe in toothpaste. We discussed how the European Commission has approved it, provided it's a rod-shaped crystal. I think we want to wrap this up for some questions. So Dr. Rowling, go ahead.
Yeah, I hope you have your skates on, Peter and Dr. Jen, because you have some questions, and they're great questions. Let me start at the top here. Okay. What about SLS?
Yeah, sodium lauryl. Yeah. Sodium lauryl sulfate it causes mouth ulcers, oral tissue inflammation. There's studies on this that if you actually can remove that to the tooth from your toothpaste, your patients should see that it can reduce pocket depth. And so there are other replacements for foaming. Foaming can be good. There's biophysics mechanism that will help remove plaque and food from the surface pores, but it will also help spread toothpaste between the surfaces of the teeth. But sodium lauryl sulfate in itself is not a good foaming ingredient. There are safer or gentler foaming ingredients available.
Are your toothpaste products still using plastic containers?
Heck yeah. Have you ever tried to use glass? Glass is very dangerous. They usually drop on most people have a tile floor. But that being said, if I can answer this now, our tubes use 1/3 the plastic. But plastic, it's unfortunate. There isn't a decent way to deliver a liquid toothpaste other than plastic, especially in a bathroom. If you got children and you've got tile, glasses. We like glass for obvious reasons, but we have safety issues to deal with.
Yeah. Shipping would be a nightmare.
Yeah.
Shipping it would be a nightmare. Question about phosphate and calcium. Do you think there's also a systemic deficit?
That's a good question. I think so. What do you think, Dr. Jen? That's a good question for you.
As far as remineralizing teeth, so if there's not enough in the body, I would say absolutely. And I mean, obviously, it's going to tie into saliva production. But one of the most interesting things that we learned in researching nanohydroxyapatite is how much it's actually in our food already, because it's a wonderful source for calcium and phosphate.
Do you recommend drinking alkaline water?
That's a good question. And I just back up a little bit here. And they're teaching this in dental school with fluoride. And I didn't mention this. When using a nanohydroxyapatite crystal, it's recommended not to rinse. For fluoride to be effective, so have your patients brush, just spit. As far as alkaline water, drinking it, we can't comment on it. That would be more of, how your body works. Is your body alkaline? Is it negative? We do know that, we understand that. I think that's probably a better question for your physician.
Agreed.
Yeah.
Question again about the shape of the crystal. Why does that matter if it's all the same substance anyway?
That's a good question. There are a lot of concerns, and the European Commission has very strict guidelines on what they approved. And so the crystal shape they approved based on the information they had was rod shape. They determined that particular shape didn't cause cell toxicity. In their study, though, they didn't say that the other crystal shapes cause cell toxicity. They said that, well, the needle is suspect. So there is no hard data showing that any of those crystal shapes cause cell toxicity. If you read the European Commission safety report, it was just their opinion and guidance in toothpaste. They said, yeah, it's safe provided it's rod shape and it doesn't exceed 10%. But I think that's a really good question. There's not enough research on all of the different shapes to really answer that question.
Does nanohydroxyapatite also help with dental hypersensitivity?
Oh, heck yeah, it's better than potassium nitrate. And we said on the slides a little bit, it goes after the underlying problem. It will coat weak areas of enamel and exposed dentin, where potassium nitrate is a pain blocker. It's much more effective.
How long until it remineralizes incipients?
Yeah, great question. The slides that we showed you, the first study was over a 7-day pH cycling event. The second study was over 4 week period. So based on the studies, you will see remineralizing anywhere from 7 to 4 weeks with the studies that we presented.
Does SDF treatment affect nanohydroxyapatite's mechanism and effectiveness?
What is I'm sorry, what did you say?
SDF.
What? And what is that? There's so many SDF acronyms. What does SDF mean by that?
SDF is used for caries. Are you familiar with it?
Jennifer?
Not familiar with it.
Yeah.
Okay. Nicole, reach out directly and I'll shoot them an email a little bit later. Why are nano hydroxyapatite toothpaste so expensive? Hard to convince people with a limited budget to use.
Yeah, great question. But if we break it down, it's not that expensive. A typical tube costs $20. That's $6.60 a month. For the price of a Starbucks, you'll have one of your patients go buy a Starbucks and not even think about it. But for the price of a Starbucks, you'll get a month's supply of toothpaste. It comes out to 20 cents a day. Why is it more expensive? Fluoride only requires about 0.2 to 0.24%. Nano hydroxyapatite requires 10%. So that's one of the main reasons why it's so much more expensive. For it to deliver optimal caries protection, it requires such a high concentration of 10%. But if we can break it down on a daily amount, 20 cents a day, most people who are out buying Starbucks or whatever, they should be able to invest in a good quality toothpaste.
And some of the toothpaste that are out there, your regular, is not that less expensive. I mean, toothpaste is overall expensive. The question, I think I understand what Nicole's asking here. Will SDF treatment affect nano hydroxyapatite's mechanism? So silver diamine fluoride. So we use it to treat early, sometimes caries for children and older adults.
Yeah, no, that's a good question. I'm not sure if that I'm familiar with it, but if it actually seals the enamel, it would inhibit that area for the nano hydroxyapatite crystals to penetrate. So I'm not familiar with how that actually affects that area of the surface. So that's a really good question.
Yeah, I haven't seen any studies on that, so I think that'd be something interesting to look into.
Is there a professional strength to use as a prophy paste, or can you use it out of the tube in the office that patients would use at home?
Yeah, there is no such thing as professional strength. That's another myth. There isn't any. There's an optimal, which is 10% in nano crystal. And so you could use it as prophy paste. Jennifer, any questions?
I think we have a lot of offices actually that do use it as prophy paste. And it's a pretty good tasting prophy paste.
But keep in mind what prophy paste does. Okay, we got volcanic ash, and we're stripping enamel. You usually strip 15 microns of enamel, and yes, people like smooth teeth when they leave, but we also want to reduce the amount of what surface imperfections where plaque can adhere to. Nano hydroxyapatite itself, as we said earlier, it does the opposite. It's going to fill in these voids and these scratches, making the surface a lot different. But so prophy paste in itself functions totally different than nano hydroxyapatite. Nano hydroxyapatite, we're almost going in, patching, smoothing the surface. Where prophy paste, we're stripping. Usually it's 15 microns of enamel per treatment.
Question here about, does nano hydroxyapatite have any interference with the etching or bonding, for instance, for composites? What do you say?
Yeah, I think that's a great question. I have not seen any studies that have looked into bond strength after using a nano hydroxyapatite toothpaste. I can say just from clinical experience alone, I've had my patients using this paste for 3 years, I think now. And my bonding is, to be honest with you, I think my bonding has improved. It definitely has not gotten worse.
There are studies, and we talked about 15 microns. When you strip enamel, let's say if it has an orthodontic appliance and they're stripping glue, they're losing 50 microns of enamel. There are studies showing that applications of nano hydroxyapatite toothpaste after whitening but also after removing glue are extremely beneficial at helping providing surface remineralizing.
We are going to transition over to information about Dr. Jen and their products, which this is considered promotional for CE credit. If you'd like to stay on a few minutes and learn more and take advantage of a discount code or order samples, this is the time to do it and ask questions away about products. We thank everyone for attending. Obviously, it's been a great presentation. There are some questions or some comments here, both of you. Maria said, this is the best, most informative and useful course ever. So, and that's just one of many. For those of you that we didn't get to your questions, because there are so many, you have contact information for both Peter and Dr. Jen in the course handout. Feel free to reach out to them directly or through their website, and they'll be happy to answer your questions. So let's go ahead now and transition over to the product information. I'm going to have Jake change that banner at the top of the screen, and it will take you to the Dr. Jen website. Thank you both.
Oh, go ahead, jump right in. Very good. I saw one other question up here, and hopefully I can answer. It says, let's see, you want to contain 10%, but I thought 2% was good. I just wanted to answer that if I can a little bit.
Yeah, absolutely.
Yeah, and this goes back to the studies. You have to ask a question. When you guys are recommending products for your patients, what do your patients want? Okay, for those patients, we know fluoride works, and fluoride's cheaper. Why not give them fluoride? So if your patients want fluoride and they want a cheaper toothpaste, recommend the fluoride toothpaste. I think the solution we're trying to create here is we're trying to create a solution for patients that want clean ingredients and they do not want fluoride, or they're looking for an alternative fluoride. Well, for those patients that they do not want caries. Okay, the simple answer is they want a product that's going to be an equal to fluoride. If we ask that question, you say, well, what do you want? And so I have that question up, what do your patients really want in a fluoride-free toothpaste? Well, the answer is very simple. They want optimal caries protection or optimal remineralizing. And this goes back to, concentrations. And so what does Dr. Jen make? Yes, we make a 10% nano hydroxyapatite toothpaste. We're not the only ones that make it. 10%. As we referenced in the first study, ApGuard Royal was a brand. It's a great product. ApGuard's their pioneer. Most of the studies done showing efficacy behind nano hydroxyapatite were done with ApGuard Royal's toothpaste. But there was a question that came up. It said, why can't you use 2%? You can use 2%. Does 2% provide remineralizing? It does. So does 5%. This was a graph on one of the studies showing that different concentrations provide different remineralizing levels. And so at the end of the day, if you think your patients just want a very small amount of remineralizing in their toothpaste and they are aware it's not optimal levels, there's nothing stopping you from recommending a 2% concentration. However, if you want your patients to have optimal caries protection, and if that's what they want, make sure the brand they're using is following the science. And that's what we do. We have 10% concentration in our toothpaste. The second thing that Dr. Jen does, and you've got it, you already know the answer, is we use advanced nano crystals. If we could cheapen our toothpaste. We could put micro in there, or we could even blend the two. We could just say, well, let's just put half nano, let's put in half micro. It's going to cut our costs significantly. But we're back to, what do you want your patients to have? If they want the ability to remineralize incipient caries, to be able to remineralize root caries, we want to make sure the crystals are small enough. So what do we have? Dr. Jen has made a 10% nano hydroxyapatite toothpaste with, you guessed it, rod-shaped crystals. So we do follow the European Commission safety guidelines on using a 10% nano hydroxyapatite toothpaste. So if you guys are interested in learning more about our toothpaste, we have the opportunity to send you some samples. I will tell you right now, we have thousands of offices that we didn't expect this coming. Originally, when we started making toothpaste, this was a family project for our family, for Jennifer's patients. But it's just, we have to be grateful for many offices sharing the success that they're having using this product. That being said, we are catching up with the demand. If you do request a sample, it probably won't be shipped out until the end of this month because we're a little bit backlogged on samples, but we want to get you some samples. So if you've never tried nano hydroxyapatite toothpaste, or Dr. Jen's is new to you and you want to test it out, contact us on our website. I'll show that to you. But what do we have? We have really 2 fluoride-free versions. We have a strawberry. We developed this for children. It doesn't have foaming in it, which most kids have, like a sensory issue. And then we have a mint that does have foaming. We do not use sodium lauryl sulfate, but they both contain, you guessed it, 10% nano hydroxyapatite crystals. And then, this was a study we did with our super paste. Our super paste is really a breakthrough product. Jennifer, you want to talk about that?
Yeah. So I mean, obviously, I am not anti-fluoride. I'm clean ingredient. I want clean ingredients, but I do appreciate what fluoride can offer. And so I had some natural curiosity about, if nano hydroxyapatite is so amazing, what if we combine it with fluoride to allow the two of them to work symbiotically together? What's going to happen? There's a few studies that we already discussed earlier. And then this is one of them that just shows this product. We call it super paste. It is a combination of over-the-counter fluoride. It's not prescription. They can just buy this wherever. But over-the-counter fluoride mixed with the 10% nanohydroxyapatite. When we tested the two of them, it actually outperformed a high prescription fluoride quite a bit. And we hit it hard with the xerostomia environment. I mean, this is the worst environment possible. We weren't really sure what we would get. And when we found out, yeah, not only did it outperform, but it did so at 6 times. This was surprising to us and pretty cool, actually.
Yeah. So the big takeaway here is, high prescription fluoride toothpaste was created 40 years ago. Well, nano hydroxyapatite was created in 2003, a little over 20 years ago. We want to give our patients the best care. We want to do this with minimizing risk with other issues. The FDA, the Food and Drug Administration, has considered high prescription fluoride. They have many restrictions. Number one is you have to have a prescription, but there's also guidelines. For example, if you guys ever read the back of a high prescription fluoride toothpaste, especially with children from 6 to 16, it's recommended that they only use a thin ribbon. Number two, that they rinse immediately after brushing. We know that for fluoride to create fluoroapatite, it's beneficial that your patients do not rinse after brushing. Well, why would we want to recommend a product that requires rinsing? Well, we don't have to do that. We can recommend a over-the-counter level fluoride, high concentrations of nanohydroxyapatite. But yeah, the pilot study we did, the super paste crushed it. It was 6 times higher levels of remineralizing. This is the super paste itself. Let's see. We have, you can do tray applications with this as well. So if you have patients that have high caries, they can put it in the tray for 3 minutes, spit, wait 40 minutes before they consume liquid or beverage. We're actually right now, we're overwhelmed right now with the support and love we're getting from dental offices. We have thousands of offices this last year that are just sharing stories about using this product, seeing less caries, especially with our high caries patients. Let's see. If you want to buy wholesale, we sell you get 40% off wholesale. The super paste is really a replacement for high prescription fluoride toothpaste. However, it's safe enough to use like any other dental product. Most of the dental offices that we work with, if you talk to the dentists and the hygienists that are using, if they're okay with fluoride, they use the super paste every day. They love the product. Your cost is $15, retails for $25. Our fluoride-free products are very comparable. They're about $20 a tube. Your cost is $12 for the Cool Mint, the strawberries, $11.40. And then we have some sample tubes. If you're new to Dr. Jen's products and you want to get this in your office, we do have a code as part of this presentation. It's DA100. That gets you $100 off your first wholesale purchase. If for any reason you buy our products and you don't like them, let us know. Within the first 60 days, we will refund you. We've offered this up to every office, but we've never had anybody take us up on it.
Peter, I want to remind everyone too, at the top of the screen, we do have the banner that will take them directly to your website, and the code is there as well. So they can go ahead and tap on that banner and bookmark it to their device if they want to take the information back to their practices tomorrow.
Wonderful. Thank you, Dr. Rolling. And then, yes, like I said, we are just surprised by the response we're getting, and we're really grateful. So if you do go on our site, you request a sample, don't be surprised if we're unable to ship it to you until probably the end of this month, because we just have so many offices that want to learn more about the product. But we're very eager to get this product into your hands so you can test it in your clinic if this is something you guys would really like to try. Anything else you want to talk about? Well, guys, thank you for your time. And yeah, we hope that even if you don't use Dr. Jen's, we hope you learned enough about nanohydroxyapatite where when patients are asking you questions about the nanohydroxyapatite material, you feel confident about guiding them on what to look for in choosing a brand that will have efficacy to deliver the same caries protection as fluoride.
We have some minutes here and we have more questions, so we can take a look at those. Yes. Is this safe for any age?
Love it. Yeah, it's safe to swallow. So any age, and that's really the nice thing about, go ahead, you want to talk about your strawberry toothpaste for children? Why you
Oh,
created it?
I mean, yeah, we created the strawberry just because we felt that that might be more, appreciated by somebody who is younger. But it is, safe to swallow. They don't need to know how to spit to use this toothpaste. So no worries on that end.
Let's see. Is there a toothpaste that combines both fluoride and nanohydroxyapatite? And I think you have answered that sufficiently. And go to the banner and you'll learn more. So an infant can use the paste?
Absolutely.
Okay. Is there a product you recommend to apply after hygiene visits?
As far as, Dr. Rolling, would you take that to mean as far as toothpaste?
Yeah, or maybe, I guess so. I mean, what do we normally apply after a hygiene visit? I guess sometimes some folks apply fluoride foam, which I hate. But that's me personally. I'm a public health dentist. I like varnish myself. So, but in terms of nanohydroxyapatite, they could definitely go home with toothpaste and continue using it, right?
Yeah, and as we said earlier, the clinical studies testing nanohydroxyapatite in the varnish environment were done using a gel. It wasn't putting it in an actual varnish. So if we don't want to seal the surface pores and the dentatubules to allow more remineralizing, it's better to use a tray application. I put the slide on. So that would be a treatment we would recommend to help provide higher levels of remineralizing. So you would spread the toothpaste, put it in a tray for 3 minutes, have them spit, and then wait 30 to 40 minutes before drinking or eating.
Perfect. We have a question here. Where are the graphs comparing 5 and 10% to 15 and 20%?
Oh yeah, I'm glad they asked that. I'll go back to this slide here. So this is I don't know if you can see this slide. This shows 1, 5, 10. We didn't put the 15% on this bar. And the reason for it, if you read the study, you plateau. If you read within the abstract, there wasn't a significant difference. Basically, there wasn't a noticeable difference between 10 and 15% with this particular study. But I'm glad they picked up on that. I was going through those slides a little faster because we were coming up on the hour. But if you look at this study, and there's a link on this study here, they tested 1, 5, 10, and 15%. When you get to 10% with this study, the remineralizing levels plateaued. So there was really no additional benefit to increase concentrations above 10%, number one. Number two, the European Safety Commission, they approved nanohydroxyapatite in a nano form only up to 10%. So there's two reasons why you don't have to go above 10%. But with this graph, it does show 5%. We've got gray bar represents 1, the teal is at 5, and then the blue is at 10%. So at 5%, yes, you're going to get less remineralizing than you will at 10%. But in all fairness, we're not saying that you're not going to get any remineralizing with a micro or at lower concentrations. You will get some benefit. However, for optimal caries protection, or to provide the same remineralizing levels as fluoride, they were done at high concentrations of nanocrystals.
Okay. Question here about does it cross the blood-brain barrier?
Yeah, we talked about that with the European Commission. I'll go to this slide here.
Mm-hmm.
You can go to, we can share I think it's on the studies on our original PowerPoint, but the scientific committee, we talked about this a little bit, they approved nanohydroxyapatite in toothpaste provided the concentration doesn't exceed 10% and that the crystal shape is a rod-shaped crystal.
Okay, someone makes a comment, just had a patient ask me about hydroxyapatite. I'm so glad for this information. Another about age, which we've already addressed here. Any allergens that patients should be aware of? Shellfish, nuts, dairy, gluten, egg?
Yeah, that's a good question. We've actually developed a eggshell nanohydroxyapatite. We haven't released it because we have some folks out there that are purists. They do not want to synthesize. Our nanohydroxyapatite, though, is it's a synthetic nanohydroxyapatite, so it doesn't use bovine, which would be what dairy cow, or shellfish, or egg. So our version in itself is a synthesized nanohydroxyapatite crystal. But yeah,
Question. Oh, sorry, go ahead.
Oh, I was going to say there might be some brands out there that could use something that would be egg, but that's a good research question.
Do they have to order right now in order to get the $100 off?
That's a good question. I mean, my guess is we'll probably keep that open for the month of April.
Okay.
And so the next few weeks.
What is the expiration of the product?
Great question. And I'm going to talk about this. Can I jump on this?
Jump on
This
it.
is really cool stuff. Okay, because somebody asked earlier about plastic. All right. Our tube, we use 1/3 the plastic, which is really cool. So Jennifer's very eco-friendly. Most tubes use 3 times the amount of plastic. Well, our tube we have 2 sheets of plastic, really thin, with aluminum barrier in between. So that helps preserve the ingredients. Number 2, our toothpaste tube doesn't expand. So when you squeeze the tube of toothpaste, air is not drawn in where the toothpaste will oxidize. That allows us to use clean ingredients, and our shelf life is 3 years before the toothpaste is unopened. We're producing toothpaste about every 3 months. But if you read the expiration date, it's usually 3 years. But after you open the toothpaste tube, it will last a year. But where I'm going with this is we designed, Jennifer being the engineer she is, we took into some considerations to reduce plastics in the ocean and our landfills. We only use 1/3 the amount of plastic. But number 2, the design of our tube is to help extend the efficacy of the ingredients, because we use some essential oils, which we didn't even talk about. We have essential oils which are great at reducing halitosis. But there you go. 1 year after you open it. Otherwise, it's 3 years from when we manufacture it.
Can patients purchase anywhere other than your website?
We have Amazon and then Dr. Jen's.
Okay. Does your toothpaste contain sodium benzoate?
No.
I had a reaction to sodium benzoate last month. It was a nasal saline, which was supposed to be a clean product, and just created so much inflammation. And I looked at it and okay, that's what it was. Stopped using it and I was normal. It says discount code DA100 is not working.
Uh-oh. I'm in trouble. All right.
We'll go on to more questions here. Take a big breath.
It will be working soon.
I'll fix that. All right. That's my fault. Sorry, guys. I will have it fixed before the end of the evening. I'm so sorry.
Can you use this paste instead of Prophy paste if there's no stain present?
Absolutely. Yeah, I think that this is great. I mean, you saw you can use it in a tray, but you can absolutely use it as a Prophy paste as well.
Rhiannon said, thank you, Dr. Rolling, for being a wonderful host and for having flexible hours for CE classes. You all are welcome. We love having you here. Are you recommending nanohydroxyapatite in lieu of resin infiltration techniques for treatment of incipient lesions?
Well, there's studies showing that nanohydroxyapatite crystals, the one that we showed was at the University of Texas. So we have many offices using it as a toothpaste to remineralize incipient caries. We can't comment on other methods to remineralize incipient caries, and I'm sure there's other.
I don't think that there's research out there that compares various, modes of treating incipient decay. At least comparing it to nanohydroxyapatite in paste form. So I think research would be really interesting to see, but I don't think we can comment on what would be the better thing to do.
Can a higher percentage of nanohydroxyapatite be used in a tray? Would it be more effective, especially if mixed with fluoride? As stated in your fantastic presentation, they are synergistic.
Heck yeah. If they're okay with fluoride. We've been developing a varnish that has 2. What happens is you're really, when you mix the 2, you're actually getting more of a fluoroapatite crystal. So it will perform better, definitely.
Is there any way that they can buy just 1 tube of the super paste to try on their own?
Absolutely.
Yeah, and why don't I put out a discount code off, just OFF and then 10. that would give them $10 off any trial to
Okay.
so lowercase OFF and then this 10 off 10 is $10 off.
Lowercase OFF 10.
Yeah. Yep. That
Okay.
gives $10 off.
Have that in the chat area for you all.
There.
Make sure that it went over to the right side. Okay. We're getting down, hopefully down the wire here. There's quite a bit, so we don't mean to abandon anyone here. Let me go through here. Where does the hydroxyapatite come from in your toothpaste?
Oh, love that question. We source all of our ingredients in America, in North America, in all over Europe. We have many competitors that want to know everything about all of our sources, so we cannot disclose where we get our actual material from. But we can say it follows the European Safety Guideline Commissions. It's a non-altered rod-shaped crystal. Yes, so there. Sorry, we cannot disclose the actual sources of our ingredients.
How about availability in Canada?
Right, we're a little bit too young to. We're working on that. Let's say it's a work in progress in Canada right now.
And it is a major work to have in progress. It may take a little bit, but they'll get there. It's not. We're dragging our feet on this thing. Canada, there's a lot going on. Okay, how do you feel about MI paste?
All right, I think MI paste was ahead of its time. It's like what, over 30-year formulation, so we got to give them credit. They were one of the first to find a replacement for fluoride. But if we look at their formulation, it's over a 30-year-old formulation. It's not a clean ingredient product, and it's overpriced. It cost about $20 for a 1.1 ounce tube. More importantly, it's liquid phosphate and calcium. For a liquid phosphate calcium to remineralize, it has to crystallize in the mouth itself before it can be accepted as remineralizing. Nano hydroxyapatite are crystallized forms of phosphate and calcium. So it's more efficient for the human body to remineralize enamel using a crystallized state of phosphate and calcium. So we can't say bad things about MI paste. I said it's ahead of its time, but if you're comparing it to nano hydroxyapatite is superior.
So question, micro is not recommended and only nano, correct?
Well, we can't say that. What we can say is micro is old. Okay, that's what NASA created in the 70s, and that was the first iteration of hydroxyapatite toothpaste. 2003, technologies advanced where Sanji was able to advance into a nano crystal. If we go through the biophysics of nano hydroxyapatite and the biochemistry, we want these crystals to penetrate surface pores and get into the dentin tubules to remineralize incipient caries and remineralize root caries. Microcrystals cannot do that. They're not going to be able to penetrate surface pores, and they're not going to be able to penetrate dentin tubules. So if you want some surface remineralizing, micro will accomplish that. However, back to the science, if we read the clinical studies supporting nanohydroxyapatite's ability to deliver the same efficacy as fluoride, it was done using nanocrystals. Does that help? Hopefully it helps.
Where does hydroxyapatite come from in general? That's a question. Where would you find it?
Well, you could find it in eggs. You could find it, or eggshells. It's bovine teeth. They can grind it up in seashells. That's the natural. Otherwise, it's just made in a facility, a manufacturing facility.
Question about any studies on post-ortho white spot lesions or prevention thereof?
There are some studies. Jennifer, you can speak to that in your office of decalcification.
When we see patients, this is not a study, I'm going to tell you, but when we see patients that come in with really poor hygiene, bright red gingival tissue, clearly not doing their job, right? I give them a tube of the super paste. I take some photos, give them a tube of the super paste, tell them to come back in 8 weeks. Some of it is obviously just awareness and they're brushing better, but a lot of it, they look a lot better. The gingival tissue looks better. The enamel looks a lot stronger.
Question about ordering. Do you have to create an account to order one tube?
To order one tube off of the consumer site,
Oh, yeah.
you'll have to put in your name and address and all of that.
Okay, yeah, this is Dr. Rowling. For that code to work, that would be under, we have a direct-to-consumer site, and I apologize. That's Dr. Jen Natural. So it's DRJEN, and then the word natural.com. That's where that code is for. That's where they can get one if they just want to order.
Oh, okay. So right now on your presentation, it went to Dr. Jen Oral Care.
That's the wholesale site for the free samples. Yeah.
Okay. So for next time, we'll have to make a landing page to get them both there. But
Yeah,
so go to Dr. Jen Natural, and what are they going to put in?
That at checkout, they type in off 10. That'll get them $10 off.
Okay.
They can select
Okay.
one, two, that site. Yeah.
Okay. So off lowercase 10. All right. We've put that we've got that out of the way there, hopefully. And of course, they can always reach out to you tomorrow with questions too, right? So
yeah.
Let's see, anything else here as we wind down here last 2 minutes. This is recorded for anyone that wants to share it. So yes, and handouts links will be sent to you afterwards. Yes. I'm trying to buy a single tube of your super paste and your Story toothpaste. Okay, that's why we've got that cleared up. The link is there for you. Can you send samples to Ontario, Canada?
I don't know. No, I don't think we can, not yet.
Okay. All right. I would say if we did not get to your questions this evening about the products, it's a good reason to reach out to Dr. Jen, and they're going to help you figure out what you need and how to get it. And anything that you'd like to say in closing, I want to give a shout out to Maria here, who's had some surgery and gut issues, and she's definitely interested in purchasing too.
Oh, I love that. We just want to thank you for listening, and we hope that this helps you, with your patients who are looking for a clean ingredient paste.
Yeah, and I think the only thing I would finish with is, guys, you don't have to buy Dr. Jen's. We're here, we solve the problem. Hopefully, though, as I said earlier, we gave you some really good information to help guide your patients to choose products with efficacy. And at the end of the day, we all have the same goal in mind, and that's to help our patients have healthy oral care. And if we contribute at any level, we're just happy to be part of that.
Terrific. Well, I want to thank you both for being here. This was a great presentation. You've had so many people, you haven't been able to see the comments, but so many grateful people to have you here this evening and create what you've created. And we're going to go ahead and close out and get everyone directed to complete their quiz. So thank you again, everyone, for being here. And please check out the website. Recording will be available here probably later this evening. All right, everyone. Good night. Thank you.